Welcome to True Health Tuesday, and the truth will set you free. Okay, we're going to go over back pain, but I mean, this is kind of cool. Back in the 50s, they had pretty spines, okay? That's kind of cool. So, you got structure and beauty. Now, we are going to have a censored portion on here that the powers that be do not want you to see because the government is controlling a lot of the information. But if you're watching on Dr. B VIP, that'll be uninterrupted. And this coming Sunday for Extreme Health Academy, we do a once a month webinar, and this is going to be on for the members, and it's fun. It generally goes an hour and a half to 2 hours of constant Q&A, and it's really fun. Okay, now this is out of the Lancet. And I went to a 12-hour seminar this weekend for relicensing, and usually continuing ed seminars, it's like, okay, and you try and get paperwork done and everything. This was really interesting. I'm telling you, okay, I was like totally nerding out. But one of the guys there is with the World Federation of Chiropractic, and he says that back pain is the leading cause of disability in the world. Now, when you think about this, the majority of countries don't have like workman's compensation. They don't have unemployment insurance. You don't work, you don't eat. Okay, so I'm thinking this is crazy. Now let's look at this article. What low back pain is and why we need to pay more attention to it. It occurs in high and middle and low income countries and all age groups. Okay, it's increasing. 54%. They blame the aging population, and that's not from it. But now this is the disturbing part. Low back pain is the leading cause of disability in the world. Now remember, this is the Lancet, okay? For nearly all people with low back pain, it's not possible to identify a specific nociceptive cause or the cause of the pain. That's what that means. Only a small portion of the people have well understood pathology like fracture, malignancy, or infection. And people with physically demanding jobs, physical and mental comorbidities, and obese individuals are at greatest risk. Disabling low back pain is overrepresented in low socioeconomic status. We're going to go over how insane that is and how blind the health authorities are, because it's literally, I'm going to show you how to identify it. I'm going to show you how to address it, and how the current health authorities are completely missing the boat. Now, when we look at this, when we talk about physical, chemical, emotional stress, look what they address. Initial high pain intensity, psychological distress, accompanying pain in multiple body sites increases the risk of persistent disabling low back pain. I'll show you why that is. You can have one source and your body will be affected all over the place. Disability cost, intensified research efforts and global initiatives are clearly needed to address the burden of low back pain. This will not work because the authorities that be are looking for chemical solutions to a mechanical and neurologic distortion. So if you can't drug it or shoot it, okay, and you can't cut it because it doesn't work, let's find out. I'm going to start off by giving you the solution. Number one, okay, back pain. Let's look at a back. Okay, here you go. This is a perfect spine. The head is lined up with the pelvis. We have a 45, 36, a 32, 36 degree curve. I mean, it's beautiful. The facet joints, the joints of the spine are laid at 90 degrees, 60 degrees, 30 degrees. And it's like this, so it can't be crushed. It's amazingly strong. The spine gets its strength from the curves. Now, what happens is, if there's a trauma or an accident, you put this baby under the same force loading and it compresses. So you have to look at what normal is and what abnormal is, because you could have had trauma years before. Now, these muscles are going to tighten up if there's pressure on the nervous system. So in ignorant, crazy world, you're going to use heat to relax those guarding muscle spasms. However, that makes the nerve swelling worse. Now, ice will not heal this. Ice will not heal back pain. Ice will shrink swelling. Now, inflammation is how it heals. So do not use heat on the spine. Do not use heat on the spine. Ice will shrink the swelling. And all this has to be governed by the doctor that found the problem. So if you just have back pain and you're putting ice on there, you can put ice on there too far or too long, and it causes damage to the skin. It can cause a lot of damage. So don't just randomly use ice. Find out what the problem is. Now, if there's a huge amount of inflammation, ice can shrink the swelling, which will make you feel comfortable. But remember, inflammation is how the body heals. So we want you comfortable, but we want you healing. But to have a problem or a challenge, bam, you have an accident, that means these muscles are going to tighten up. And if muscles tight for a long time, it's going to leach lactic acid. So if you put heat on there, it will feel better, but you're going to make the nerve swelling worse. Okay, ice will shrink the swelling and make you feel better. Never, ever, ever lay on your back flat. Why? Because look at the holes for they're called intervertebral foramen. The discs should be narrow at the back, wide at the front. When you lay on your back, that opens up all those nerve holes, so it feels better. Oh, bummer, look at this. All the discs are now reversed. So a lot of physical therapists, a lot of doctors, a lot of chiropractors will say, look, bend your knees, put a sleep with a pillow underneath your back. You are doing damage. You're flattening out the curves. Remember, the spine gets its strength in the curves. If you flatten out the curves, that's not good. Restore the curves instead of muscle stretching. And we're going to go over all the different ways to restore those curves and by using simple devices. Okay, so no matter where you are, you can use a water bottle, you can use a foam piece, but you're not going to be increasing the curve down here. It's going to be at the junction of the thoracolumbar junction. We'll detail that in detail. A firm foam piece. If you use something like this, a roll of paper towels, right diameter, except look, it squishes. You cannot squish this. Okay, so just know that we're going to change that. All right, I'm going to detail it out. Movement is your friend. It turns out that all of these discs, they're 70% fluid. And if they get their movement or they get their fluid through movement, so you're going to have, and I'm going to give you certain exercises to twist and turn to fill those joints up with fluid, which is going to actually ultimately heal the problem. Sitting with a water bottle, rolled up towel, stabilizing the pelvis, twisting exercise. But this has got to be approved. Now you're going to see that picture up there of a girl sitting backwards, kind of like a cowgirl. Amazing. Okay. As long as you don't have a serious pelvic problem. If you're able to sit like that, the legs are literally going to approximate the pelvis and take a lot of pressure off. So let's get into this right now. First, the muscles that run down either side of the spine, they're not under conscious control. They're under proprioceptive control. So you cannot, and I'm talking the muscles that run from the skull all the way down to the pelvis. So these muscles, you can't tighten, you can't loosen. But if there is a challenge or a trauma, and this could have been falling off the swing when you were 7 and now you're 40 years old, the muscles on the outside of the curve are always going to be trying to tighten to straighten up the spine. The muscles on the inside of the curve are usually guarding, but they're generally relaxed. So you got to find out why the muscle is spasming before you're going to relax it. And also, since the head is supposed to be over the base, if that head's forward, for every 1 inch forward, the pressure on those discs double. That means these muscles are going to tighten up, and that's why in between the shoulder blades gets so gosh darn tight on people. So you have to address not just the problem, but also the adaptation. Now, discs are incredibly tough. You're talking 80 interconnecting rings of ligament. Now, when I was teaching human dissection, you can pass a probe that kind of looks like a pen into a bone pretty darn easy, okay? You can't beat it into a disc with a hammer. Discs are that tough. But they're 70% fluid and they get their nutrients through movement. So you got to know movement is going to be the key. Lack of movement is going to be the contributing factor to having damage to the back. And luckily, the body tells you where the problem is. Okay, now if you have pain going to the butt, below the butt, okay, guess what? There's actual patterns for that. They're called dermatomal patterns. So if you pinch one of these nerve roots, it has a pattern, and you'll see this dermatomal pattern where if it goes down to the groin area, you're looking at T12L1 or right at the junction of the rib cage and low back. If it goes down on the inside of the thigh, that's L2. L3 goes to the knee. So people will literally tell you. So doctors, listen to the patients. There's two things you got to do. You got to ask the patient, then you got to shut up and listen, okay? Because the patients will literally tell you, gosh, doc, I don't know what it is, but it goes right down here. And if you're a dumb doctor, you're going to say, does your neck hurt? No, they're telling you where it hurts. Okay, the further away from the site of damage, the more that nerve is crushed. Okay, so listen to the patients. Look at dermatomal patterns. That'll clue you into it. Now, this is a really cool video that I can't show you. I don't have the technical expertise and I forgot to set it up. But what I'm going to show you is how you can start to decompress your disc yourself. So number one, I'm talking about a standard low back problem. And this is going to be a sprain, strain, anything. And when you think about this, let's think crazy world, okay? You're in the car, you reach around, you pick up your purse and your back goes out. And then bad doctors will say, well, you shouldn't lift and turn at the same time. You're that delicate, okay? So let's just think of this, okay? You and me, okay? We're out hunting 2,000 years ago. You make a beautiful shot on an ibex, okay? Okay, I mean, amazing. And I say, be careful, don't bend and turn while you lift. Okay, yeah, stupid or stupid, okay? No, that person sitting there, when you're sitting, you're increasing the pressure on the L5S1 disc 5 times normal, except you're sitting on the butt bone here, which flattens out those discs, opening up the hole where the nerve comes out so you don't feel it. It feels good. So if you're sitting without getting that corrected, then there's a problem. So let's go into exercise for sitting. What you do, you take something that's not very compressible. Bottom of the elbow is where the bottom of this roll goes. And so it's going to be placed right here. So the apex of it is just about at the rib cage area. So what's this going to do? It's going to apply pressure, creating a negative pressure on the front. Okay, actually helping de-stress out those. It's going to move the disc from the back to the front. Now, it's also, by restoring the curve here, you're going to de-stress out the whole rib cage thoracic area. It's amazing because when you're sitting, you're actually damaging those discs. Golf increases the pressure on that disc 8 times normal. Sitting increases it 5 times normal. So you're going to be placing this bottom of the elbow is the bottom of the roll, 20 minutes in, 10 minutes out, 20 minutes in, 10 minutes out. And this is the exercise we give patients after we've done the physical exam, the nerve scan, all the x-rays, the thermography, that we give them the entire report, look at their history, adjust them, then we give this to them. So I'm telling you that because before you start doing this, make sure that you have a doctor that's qualified, not some guy that's going to push pills and shots and surgery on you. I'm talking about somebody that can actually restore the shape of the spine and then get their opinion if it's good for you. Because unless you have some kind of weird pathologies or surgery, it will be if you're human. So it's placed back there for 20 minutes, take it out for 10 minutes, 20 minutes in, 10 minutes out, the whole time you're sitting. So if you're sitting at a desk for 8 hours, this is going to be in there and out. If you're flying an airplane, in and out. If you're driving a truck, in and out. So this way, you're always having that under a negative pressure and positive pressure. And remember, what does that do? Discs get their nutrients through movement. It's amazing. Now, you can see Dr. George, his arms are on the side of a chair. So now, in an acute problem where that disc is pinching that nerve root, de-stressing it out, okay? Now, you've got the foam piece in the back, okay? So you're having a force loading going from the back to the front. And then you can push down on the arms, which de-stress out that. Oh my gosh, it's going to feel amazing, amazing. And then you're going to say, gee, I don't have a chair with arms. Okay, back 2 chairs up on either side. Put your elbows on there and lift up. And you don't have to lift up a lot. Just a little negative pressure is going to be amazing. And this is a home device. And I mean, I do this if I'm working on my friend's farm, if I get screwed up on the weekend, okay, I'll go in there and de-stress out my joints. But I know my structure. I haven't had spinal surgeries. Now, twisting is the greatest exercise you can possibly do, but it's also dangerous. Okay, so again, we do stress x-rays, we do everything to make sure that this is okay for our patients. So once you get approved for this, you want to turn the body. Now in totally acute strain cases, you can sit down, put your hands on your leg, and torque your body just to the point of discomfort, then torque it just to the point of discomfort. You can also go a little bit more one side, a little bit more the other side. When you're approved for this, and I just had a patient who's been in absolute agony for a week and a half, okay? And I've been saying, look, do this exercise, do this exercise. You're going to be okay to do this. This is the scariest, but one of the most effective exercises. Stand with your feet shoulder width apart, lock your hands like this. The reason you're locking your hands is for momentum, because you're going to throw these arms as far as you can, but you want to keep your chin up. You're going to turn as far as you can, but you're throwing the arms, because this is not really good movement. This is passive, active range of motion as far as you can move it. Active is that far. Passive is a heck of a lot further, where someone's moving it. Where you can hydrate the spine is beyond that. It's the paraphysiologic range of motion. So what you want to do when you're doing this exercise, and again, make sure you're getting approved from the chiropractor that's checked your spine, or, there's a lot of countries that chiropractic's not licensed. Any qualified doctor that can assess, find the problem, and is familiar with fixing the problem. Because chin up, head, neck, everything is turning, and you're going to throw your arms. So you get that. I think I just messed up the mic, but okay. And literally to the other side as well. Literally doing, and we recommend at least 100 of those. I do 100 every day to start the day off. Why? Because I need to hydrate the discs. If I'm feeling down in the afternoon, that motion is going to stimulate information up to the brain. It works fantastically well. Now, when you're looking at these chairs, this is a good one, because you're not sitting static. You're always moving your pelvis, so you're always trying to stabilize. The ball chairs are excellent. But again, look at all the different things: water bottles, foam pieces, rolled up towels, everything that you could use to start to restore those curves, to take the pressure off of sitting. Now, arthritis. Don't be afraid of arthritis. The most common type is osteoarthritis. It's also called degenerative disc disease. It's also called degenerative joint disease. Here's the problem. It's not joint inflammation. It's not a disease, even though it's called a disease. It's literally the body stabilizing joints, because that disc is 70% fluid. Bam, there's a trauma. That disc gets less motion. It gets compressed. So the body increases the surface area, or laying down what ignorant doctors will call as bone spurs. They're not bone spurs. They're actually the body stabilizing that joint. Now, if there is motion at that joint can come back, and then the bone spurs, through Wolff's Law, will be resorbed, and you can literally see that the disc spaces become larger if you can restore motion. And MRIs. This is, again, where doctors have a challenge. If you're laying down, okay, and you got a magnet spinning around you, okay, beautiful, okay? You got gravity pushing down, you got the table pushing up, and inflammation distorts the MRI image. Okay, so we know that a supine MRI, when you're laying on your back, isn't accurate. But those have the highest Tesla rating, and the Tesla is the amount of energy in the magnet. If you're standing up, they're only low Tesla ratings, so the image isn't going to be as clear. But also, how long, particularly if you're in pain, can you be standing weight bearing, even though it gives a heck of a lot more accurate view? You figure an MRI takes at least a half an hour, and if you're painful, You're going to be moving a little bit, which will distort the image. So it's very, very challenging. I'm not a big fan of MRIs. Why? Well, here we go. Dr. Stephen Brownstein, board certified medical radiologist. Forward to the Essentials of Skeletal Radiology, which that book's in our library. Significantly more pathology is discovered on an MRI scan done with the patient standing or neutral or standing in extension position compared to a conventional MRI. Okay, let's look at this. And this is out of clinical radiology. Supine magnetic MRIs is routinely used for the assessment of low back pain and radiculopathy. However, image findings correlate poorly with the clinical findings. Wait, so if you have a doctor that's basing his assessment on the MRI, because remember, you got gravity pushing down, you got the table pushing up, and inflammation distorts the MRI. Then you got the standing weight-bearing one where there might be another radical shift. Okay, so it's not right. Now let's see. If the surgeon is using erroneous information to operate, okay, then why is this? Okay, well, we understand why this is there. It's called failed back surgery syndrome. This is actually a billing code. I mean, surgeons fail so often. Surgery fails so often that there's now a syndrome for it. There's no syndrome. Syndrome means we don't know what it is. Heck, we know what it is. They were working in the wrong place. So now, so here's Peter Ehrlich. Okay, by far, the number one reason back surgeries are not effective and some patients experience continued pain after surgery is because the lesion that was operated on is not, in fact, the cause of the patient's pain. We're working in the wrong place. Okay, so now let's look at this. This is the Surgery and Neurologic Journal, 1998. Now, if you knock the person out and wake them back up and there's no like infections or anything, that's a 98% success rate. Now, if it positively affected their pain, that's a different question. If your pain reduction, if you're fusing 3 levels, you get a 15% success rate. If it's 1 level, okay, between 40 to 80% success rate. If workman's compensation, you have a 29% success rate. Do you see what I mean? And this is why. Let's look at this patient. Okay, we're talking that if this person, and just imagine, okay, that you have back pain. And so let's say that you hurt here. The body is going to bend away, opening up that area to take the pressure off the nerve. Does that make sense? Well, you're not going to walk around like this. There's a thing called a riding reflex. So then you're going to be standing up like this. So now your entire torso is shifted off to the side, creating secondary problems as well. But your back doesn't hurt anymore. Okay? But then your body can only compensate so far. So you're going to start to, instead of having the beautiful curve, lean forward. So that it means in between your shoulder blades is now going to have to, instead of going curving out like a normal kyphosis, it's going to start to dip in. That's why between your shoulder blades is hard, okay, or tight. And you may have had a loss of curve in the neck, so that's going to have to compensate as well. And then you have this configuration, okay, and the doctor is going to, do an MRI, identify a problem here, fix that, not address anything else, no physical, chemical, or emotional stress, and wonder why it didn't work. Any wonder? No, it's just, you got to look at the whole body. They call it holistic, but it's just common sense. I mean, can you imagine having somebody in pain and giving them a drug that destroys the building block of cartilage called proteoglycan production? It destroys joints, okay? It accelerates bone destruction. It decreases cartilage production. I mean, mind-blowing. Steroids. They have a limit of how many steroids you can inject because it destroys the bone and connective tissue. It weakens it, okay? And can you imagine having a spine like this, having someone with pain here, injecting that area and saying, you're good to go. We're not going to address anything else. We're just going to shoot you and you're going to be just fine. Okay, so this is how you got to assess it. Take a standing x-ray, neutral. Person standing even. We bend to the side, take a picture, bend to the other side and take a picture. And you can actually see abnormal disc motion, okay, under weight-bearing circumstances. But do we stop there or should we look at the whole spine? Survey common sense says, yes, look at the whole spine. You're right, because there could be something else. Heck, your head weighs around 15 pounds. Okay, if that thing's forward, your body's going to be compensating. So you got to look at the neck that's going to be involved. Here's a patient, 7 surgeries. And I know what you're thinking. That surgeon is the greatest salesman in history. Yeah, I know we just done 5 surgeries and it didn't really work, but I know this 6th one's going to be good. Okay, the 6th one didn't work, but boy, lucky 7, that's your number there, sir. Okay, and what's wild is you can't work on the surgery site. We're looking at fake discs, we're looking at bolts and screws, we're looking at laminectomy, we're looking at a bunch of stuff, okay? But it was the problem above it, and also the cervical spine. There's a bunch of stuff. Now, discs are alive, they regenerate. So you can, by causing a force loading in there, restoring normal biomechanics, fixing, what do we have to fix? Do we have to fix the disc or physical, chemical, and emotional stress? You got to address all 3 of the stressors. That's just common sense. Now, all of this stuff, if you're hurting, your gait's going to be off, right? Okay, so we got to look at the pelvis. Now, no matter how many genders you think there are, there's 2 types of pelvis. Okay, male and female. Okay, male looks like a martini glass upside down, and I'll show you, because like this looks more like a martini glass, so this would be a male pelvis. A female pelvis looks like a margarita glass. It sounds kind of gross, okay, but that's the mnemonic that I would give the students so they would remember, is that a male or female? Trust me, you'll never forget it. Well, you might forget it. Okay, now there's no muscle that crosses the back half of that sacroiliac joint, so it's a perfect joint. But when you're walking crooked because of the back pain, because of the altered biomechanics, you got to pay attention to it. Now, the piriformis crosses the front part of the joint. So if you're having leg pain and pelvis pain, you got to remember that this joint, this pelvis joint, is beautiful. It's perfect. It only malfunctions if there's disc problem or problems with the gait, problems with the knees or the hips or the feet. That's why when you're assessing low back pain, you cannot just look at the back. You got to look at the pelvis. You got to look at the knees and the hips and the feet. You got to look at everything. So knowing that the pelvis is going to be involved. If somebody says it's piriformis syndrome, really, why did a muscle all of a sudden spasm out? Oh, wait, I have tricep syndrome. My muscle just spasmed out. I don't know what's causing it. Okay, it doesn't make any sense. But knowing that that muscle crosses that joint, if the joint's unstable, then the piriformis is going to tighten up. So instead of calling it quadratus lumborum syndrome or tight TFL or tight piriformis, why is it tight? The muscles don't react on their own. When you see, and this is what we do 100% of the time, if someone's got back pain, okay, take off your shoes. Let me see what your feet look like. If you see that big toe leaning towards the other one, we know that that's chronic long-term issues, that the foot has been flattening out. Where do the nerves that supply the foot come out of? The sacrum and the low back, okay? And if that's a problem, it's that you know that their gait is going to be off. So no matter how long the back has been hurting, you got to restore and fix the gait. And bunions do not come from good-looking shoes like that. I know most of my favorite people in the world are more efficiently constructed than other people. Yes, dear, you are. And if she wants to wear high-heel shoes, she can wear high-heeled shoes. It won't cause bunion formation. It'll cause unstable pelvis, but that we can fix. Yeah, you do not tell a girl not to wear high-heeled shoes, okay? It's not good for the mechanics, but trust me, I've got 3 sisters, a mom, my wife. Yeah, no, you got to keep them happy. Okay, trochanter support. This is one of the keys. With long-term low back problems, you're talking altered gait. Trochanter support is the simplest, but if you don't have it, you can stabilize that pelvis with almost anything. If you're a contractor, get a good solid work belt. Okay, what you don't want, you want only the belt to cover this area. You want it below the top of the iliac crest. You don't want a belt that covers the pelvis and the lumbar, because remember, discs get their nutrients through movement. If you alter the movement with those stupid back braces, you're gonna feel more secure at the moment, but you're going to be doing damage because you can't get fluid in the disc because you're altering the motion. You got trochanter support is nice, stable, easy. It works only when you're standing or walking. And if you're going to be sitting, if you can sit, if your hips are okay, you can sit with your hips out wide or turn your chair around and sit backwards like a cowgirl or a cowboy. And what that does, bringing the legs out, approximates the pelvis and makes it feel better. Then, since we have to, look at the gait. If you've had long-term low back issues, you've got to stretch that calf. And you might think, oh my goodness, isn't that just a block of wood? Well, it used to be, but when I cut it and put a stamp on it, it's a medical device. Okay? Yeah. Okay. The cool thing is you could do this at home. So I'm giving you stuff that you could do right now. Just stretch that calf and you hold it for 1 minute. You don't want to do what the guy's doing standing on a step, because that's firing off the muscle. You want it very passive. You're just stretching that one calf. That's all you need to do. And people will say, do I need to stretch both calves? And what do I say? And this is only because I was raised in a sarcastic environment. I say, no, you only stretch the one you walk on. Okay. I know. Thank God my patients understand. This is a really cool video, and it's still up. Think how to correct the disc injury in 3 days. And I detail out how we had to bring my daughter-in-law in. Me and my son were carrying her in the office, and within 3 days, she was moving better. But it's also, you got to look at the process of it. Okay, are we totally regenerating a disc in 3 days? No. But remember, 90% of the nerves that come off the spine, there's no pain fibers. So when we do that miracle adjustment, pop, oh, gosh, the pain's gone. Great, what did I do? I took you from 95% crushed to 85% crushed. I'm glad you feel better, but we've got to do an objective analysis where we're doing pre and post x-rays to document the structural and neurologic changes. So you got to document that you're actually fixing the problem. Okay, this is one of the worst backs I've ever seen, but you're looking at 4 discs that were replaced, 3 lumbar surgeries, a couple of things of metal. I mean, this is criminal. Now, was he absolutely happy with all these surgeries and feeling great? No. Because when you fuse 3 segments, you get a 15% success rate. If you read that backwards, that's an 85% failure rate. So this is not an option unless you were crushed by a steamroller. Okay, so this is what you need to do. You need to ask around. These are the 7 questions, and that tell me if you agree with these, okay? And by the way, you just need to find a chiropractor that says yes to 5 of the 7 questions. So we're lowering the bar. Number 1, are you working blind or you take x-rays? Okay. Now they're trying to get doctors to not shoot x-rays unless they're not getting success. What the heck does that mean? 90% of the nerves that come off the spine, there's no pain fibers. So if you're working without x-rays, you're working blind. Here's one. Are you taking the x-rays because you can bill insurance? Okay, are you taking the x-rays so they can direct your care? I like directing the care. Do you take post x-rays to document the structural changes? Oh my goodness, wouldn't that be a novel thing? To take a second x-ray to show this person went from here to here, or maybe they didn't. Maybe they're not doing the exercises. Maybe they're having poor sleep patterns. Maybe you didn't address the physical, chemical, and emotional stressors. Okay, but this is why we don't just take post x-rays to do a high 5 session. Okay, we take it to say, look, you're recovering here, not really good here. Did you forget how to do the neck curve exercise? Did someone steal your wooden block? Did you burn it for firewood? I mean, because again, I was raised in a sarcastic environment. Okay, what are your treatment goals? Are you just going to get the person out of pain? Because that means you're working for an insurance company and that a bureaucrat that isn't involved in this patient that shouldn't be making those decisions, but that's the type of environment that a lot of doctors live in. Are your treatment goals to reshape and restore the natural curves of the spine? In order to do that, you'd have to do a post x-ray to document it. Okay, do you work on post-surgery patients? Are you familiar with correcting disc injuries? Can you reverse arthritis? Because if you're taking pre and post, you're seeing discs regenerate. Just get somebody to say yes to 5 of these questions. Okay, I mean, this is what you would do if you brought your car to a mechanic. Okay, mechanic, tell me what's wrong with my car. Show me that you're going to fix it. Show me the parts that you removed and the new parts in there. Okay, just like basic stuff. So let's do the same thing with humans, except with taking the parts out. Okay, how do you assess and correct? Full spine x-rays, lateral lumbar, cervical extension, nerve scans, full body thermography. It's not rocket science, but they're not teaching doctors how to assess, how to document what the problem is, and the skills needed to correct it, and then to document that you actually fixed it. It's the leading cause of disability in the world. Now, I work on a lot of people, okay, in clinics in a couple of countries, and I see people from all walks of life. We had one patient in a country that I can't tell you I was adjusting in, but she was hit by a 10-wheeled vehicle, so a thing, and she had her hand like this, and her speech was messed up, and it was so beautiful because I mean I'm just a wrench in the hands of God. Okay, I mean I'm moving a bone according to my technique, but the energy, the power of the body heals the body. The power that made the body heals the body. Within 2 weeks, she was able to hold a glass. And that's miracle stuff. That's why I like what I do. I'm working with angels. So when we put the 5 keys to healing, you need good nerve supply. You need regular exercise. That's movement. That's 100 of those a day, baby. Proper nutrition. This means your great grandparents should recognize what the heck is going in your mouth. Okay? Gee, darling, those flaming hot Cheetos, they never saw those 100 years ago. Okay, sufficient rest. That's when your body regenerates. And prayer and meditation. Okay, it seems basic stuff. Now, we're going to get into some material now that's more sensitive because we are living in a censored environment. So those that are watching on YouTube and Facebook, God bless you. Please share this. And when I say do not download or do not just copy the URL, download the video, share it, subscribe, click the notification bell because we are being banned. Okay, there are a lot of shadow banning going on, and people are not being told that we are putting up new videos, but we do at least 1 new to 2 new videos a week. So God bless you, and YouTube and Facebook. I'll see you next week. And those on Dr. BVIP, we're going to continue on.